Okay, so what I'm going to have show you now is going to be a hip adduction, or the muscles of the inside of the thigh, the groin. This is a test, but also a exercise that can be done to address muscular imbalances in the hip. Generally, we'll want to do something like this to assess for imbalances if you have either groin pain, or maybe like anterior hip pain, the front of the hip, or if you have a hip that tends to pop or snap, that might be causing you either pain, or you know that you can hear or feel a snapping hip. So the position you're going to get into is you're going to be laying on your back. Start with your knees bent. What you'll do is, let's say if we're assessing and or working on the left leg, you're going to take that right leg up, keep the knee bent, and you're going to just hold that leg with your arm. And that way it'll be out of the way, but it's going to act as almost like a counterweight for you. And you're going to straighten your left leg now. You're going to point it up towards the ceiling. Okay? And that's going to be your start position. Keep that straight leg up, and what you'll do is you will control the motion of the leg falling off to the side. Only go as far as that is comfortable for you. There's no need to push into any pain. You just want to control the weight of your leg down as far as you can comfortably go, and then you'll slowly bring it back up to start position. Very good. As a test, you generally want to try to get up to about 10 to 15 repetitions. Pay attention to how that leg feels as it's going down. Pay attention to how it feels as you're pulling it back up. It's okay if you're working on the problem leg. If you can't make it up to 10 repetitions, just do as many as you can comfortably go, and then you'll compare it to the other side. So we'll go ahead and switch. And what we're looking for when you're comparing is, difficulty level. Does it feel weaker? Can you go as far? Is the range of motion the same before you might feel like a pinch? Remember, don't push into the pinch. It's not necessary. And it's also not necessary to go the full 10 repetitions. If you can only do 5 or 7, that's fine. And as far as home program goes, if you find that there's any asymmetries and that they don't match, one side feels either weaker or harder for some reason, you'll just do this every day up to about 10 to 15 repetitions. Keep working at it until things feel a little bit more symmetric, and then of course the hip shouldn't be as snappy. Okay.